finding a way and doing that special part. I want to thank them. And if this is their mom, I want to thank their mom for doing that special deed to show what others of us can do. Let's go to the next one. I love this one too. This is a family that is out. And while we want people to be able to get outside, to take those walks, we got to make sure that we do not violate that social distance that we're asking for when we're out there. And so what I liked about this one is if people were going to get together and they were going to take a picture, they were going to model the social distance that we need to be from each other. Again, social distancing is not social isolation. And remember, we have more tools now than ever before to make sure that we can stay in touch with each other. Today, my kids Skyped with their grandparents. It was important. I think my parents, their grandparents probably got more out of it than even the kids did. It's important. Schedule them. We've talked about the importance of being on a schedule with your kids. Make that a part now of everyday life as we move through this uncertain period. Let's see the next one. So look at this. We've got those out there that try not to adjust, and then we've got those that do in amazing ways. I've seen Zoom and other ways that you can have, we always thought meetings, but personal interaction. But I never thought that I'd see a game of horse through it. You know what? That is a great idea. The ability for these kids, again, to have the social distance from others, to still be able to connect with each other. And I got to say to all these families that are modeling this, thank you. And I hope other families can follow suit. Let's go to the next one. Okay, so this is in Somerset, and their Taco John's is providing free sack lunches to seniors in need. Special. It's the right thing to do. It is stepping up at a time when people need us. So if you are around that area, I'm asking you, in the next couple days, order from this Taco John's. Let's make sure that we are helping out those that are helping out Kentuckians. And look at this. At times that we are all called to put our country, our fellow human beings above ourselves. This is a family that is working to create some of that personal protective equipment, PPE, that we keep talking about. Even if they're only able to make a couple, a day, they want to do what they can to help out in the cause. It's a very special example. Thank y'all. Oh, here is the Fuzzy Duck, which is a coffee shop in Moorhead. Makes incredible coffee. Making sure that they are still doing the story time that they used to do for kids that would come in, but they're doing it in a safe and effective manner. Good for the kids to do it remotely, and I think good for those that work at the Fuzzy Duck. All right, and then just a couple other examples about how our emotional and our physical health are going to be so important as we get through this. No matter what steps we're going to have to consider, they are still going to allow somebody to get outside and to get the exercise that you need to make sure that we are not claustrophobic, to make sure that we can take care of ourselves during this period. It's very important. You got to engage in the social distancing when you do it. But getting out there, getting that exercise is helpful for all of us. And every day, we're going to have dogs, and at some point we will have cats too. But these are just, again, a couple of examples of how we can get out there, we can wear out those animals, which love our attention at this time. They're probably the happiest that we need to be in and around our homes more often. And here, again, resiliency. You talk to this individual who I will admit I don't know about dealing with things that might not have been foreseen and about how you rise above them. I really appreciate this this tweet, I think it was, showing us all what resiliency, courage is about, getting out, getting that exercise, staying physically and mentally and emotionally strong. And those are our examples here today. I want to give you two pieces of good news and then we'll get to the more serious part about updating where we are. The first is, as you know, we talked about having 2 kids that have been diagnosed with the coronavirus thus far. One is an 8-month-old, hadn't had to be in the hospital, is doing well, is in good condition, and we appreciate all of the care that child is getting. So you know, we also had a 6-year-old patient, and that patient had to be in the hospital but has since been discharged. Again, doing well. James, can you show, and I didn't tell you we'd need this one, the graph, and it's a little bit old, about ages and impact. Now, I'm a parent, and I want to make sure that we get this out there. Again, the coronavirus appears to spread through anyone and everyone that it potentially comes into contact with. And while it can be very, very serious for parts of our population, especially those over 60 and those with heart, lung, and kidney disease, but make sure that you are not thinking about it just in those terms. It's important for me as a dad of a 9 and a 10-year-old to just remember and take a breath when we talk about kids that have been diagnosed with the coronavirus, to know that in the United States, at least as of a couple days ago, we have had 0 children that have had to be submitted to an ICU, much less anything worse. We've had some that have had to be in the hospital, but our kids are very strong. And that's just something that, as long as we remember that, and as long as we remember our kids can spread it, which means kids especially and their grandparents right now, it's very important to even limit that contact when possible. This is one of those things that helps me as a parent get through the day. Second piece of really good news, the Small Business Association from the federal government has approved disaster loan funds for small businesses in Kentucky. This is a lot of our businesses that aren't being able to operate right now, and this is an important step. So we will have a slide tomorrow to show people what they can do, but you can now apply at sba.gov, and the number is 1-800-659-2955. And if you are a Kentucky business that has been affected and one of these disaster loans can help you out, please apply. We want as many of you possible to get out there and to do it. Before I get into our steps and our updates, I do want to underscore that this coronavirus is serious. It is changing our daily lives, and it's incredibly important that we do everything we can not to spread it. So let me give the update, and then I'm going to turn it over to Stephen Stack for a minute. The tough news today, and we had good news today, is that we have our 3rd coronavirus-related death. It's a 67-year-old Anderson County resident. He had a number of other factors that contributed, but this will be our 3rd death here in Kentucky. None of us like the fact that it's happened, but we need to think about his family. Those in his community need to provide all the support to him. And tonight and every night that I have to report a fatality, and it's a small thing, we're going to light the Kentucky Governor's Mansion up green. Green is the color of compassion. It's a color of empathy. It's also a color of renewal. According to my faith, when you pass from this world, your body is just a vessel, and your soul moves to an even better and more special place. And so while I know it seems small, I hope that lighting up that building in that way lets people know that we are thinking about them, that we care about them, that we love every single Kentuckian around us, and we will do everything we can to not have to make these types of announcements. As of today, we believe, and again, the numbers get harder and harder as we have more and more labs come online, and that's a good thing. So while the numbers grow more uncertain, it's because there is more testing out there. Again, every positive fact that comes out there as we deal with this new world is going to have some negatives, but this is an overall positive with the number of labs. But today we believe we have 87 confirmed cases of the coronavirus. To try to give you what some of the new cases may be, and again, it's going to get harder and harder to do that. We believe that there is a 64-year-old female from Jefferson, a 51-year-old male from Fayette, a 73-year-old male from Warren, that's still waiting to be confirmed, and the Green River Health Department, which covers a number of different counties, and we can't give you the specific counties as of yet, a 59-year-old male, a 48-year-old female, a 23-year-old female, a 48-year-old male, a 61-year-old male. We have a newer lab online, which is called Solaris. We don't have counties, but we think we also have a 40-year-old male, a 58-year-old female from that. Then a 48-year-old female from Jefferson, a 36-year-old male from Spencer, a 23-year-old female from Breathitt, though we believe that this is an out-of-state individual that was in for some family gatherings, and I know that the area is working hard on the contract tracing, but again, it's important for us to provide the best information we can. A 55-year-old male from Warren, a 76-year-old female from Madison, a 68-year-old female from Harrison, a 43-year-old female from Fayette, a male from Menifee, another female from the Green River Health District, a 67-year-old male from Anderson, and that's the individual that we lost, and a 32-year-old male from Kenton. I know those numbers won't line up perfectly. It's the best that we can do right now. But like we said, we expect new positive cases every day. Kenneth, can you put up the Philadelphia versus St. Louis? It's just important that we know, and we've seen it, and we've seen it over and over about what these look like. This was a Spanish flu, and remember, while this is an entirely new virus that didn't exist 3 months ago with the coronavirus, we have a better healthcare system certainly than existed in 1918. And right now, we certainly believe that the Spanish flu was much deadlier than what we're facing. But again, even though we are doing everything we can to be St. Louis, while we're being aggressive and how we're cutting our social contacts, there is still, in a pandemic which we're dealing with, an increase in cases as the virus spreads. So we should be ready to see more cases. We should know that they are coming. Our goal is to do everything we can to be even better than St. Louis because we're Kentucky, and to make sure that we also have the healthcare facility and capacity to help everyone that gets sick. Because it's new and we don't know exactly how many people will get sick, we want to make sure we have all the capacity we can to take care of them. Want to ask Dr. Stack to come up and to again remind us of the importance of what we're doing. Then we'll get into the steps that we have taken, talk a little bit about where we'll go from here, and then ask some questions. But again, let me say we all have to treat this really seriously. We have had to disrupt our lives and our economy, change the way we do things every day. But this is our challenge, the challenge of our lifetime that we face. I know we're up to it, but it requires all of us working together, caring about each other as much as we care about ourselves. Dr. Stack.
Thank you, Governor. So some of you have seen the movie clips or the video clips I made on kycovid19.ky.gov. And if you haven't, I hope you'll go there because I try to stop in the studio when I have a few minutes to try to educate on topics or give you something to think about for the weekend. Now, humor is healing, and so I'm gonna but people have said maybe you should smile a little bit more. And I'm looking at my chief of staff who's nodding her head. So it's hard to smile when this stuff is so serious, but humor is healing. And so the governor does know that it's James, not Kenneth, here today, and that made me think of a meme that I like. So whoever made the Star Trek meme on Facebook, that's a good one. So shout out to you. I like that. I grew up with Star Trek. And then a couple other things. I do believe that Team Kentucky is what's going to help us get through this. It's going to be all of us coming together. I believe this is an act of patriotism. I believe it is Team Kentucky just the same as I'm from Lexington, UK ball. So just as much as you celebrate UK ball, which is the Kentucky basketball team. So, but But I want to tell you, even I'm getting stuff. I have Lori, who offered 10 N95 masks and said where she can deliver them. I had Hannah, who reached out from the Kentucky Community and Technical Colleges, offering to see whatever resources they have across their colleges to offer up, to donate. And this Team Kentucky spirit is really, really powerful. And so I want to enlist all of you. I want to just tell you how proud I am to serve for Governor Beshear, because I think he was so right to identify this as an opportunity for all of us to come together as a community so we can overcome this. Now I'm going to go back to being the doctor and the scientist, and I want to remind you why we have to do this. This is a serious infection. You all can see the news coverage from around the country. This is not something Kentucky just made up on its own. This is a big deal. This is a once in multi-generation moment in time where we all have to come together. We have to come together as Kentucky, but we also have to come together as the United States of America and as a global community of people. There's nothing short of that. Now, we will get through it. I love history. I study and read lots of history. I took 8 years of Latin. Let that sink in.
Wow.
So I really like history. This is part of the human journey. And whether it's faith or whether it's some other approach you use, it's going to require that for us to get through it. But we will get through it. Now, let me give you just specifically for the disease why this is so important. This disease is really contagious. It spreads very easy from one person to another. So when I've recommended and the governor has decided these various things we've had to say do not do, here's 2 reasons why that's so important. You put a whole bunch of people together and you have one infected person and a whole lot of them get infected, then it's like buckshot. They all scatter and they spread it everywhere they go. Okay, so we got to stay apart from each other. That's why that's so important. The other thing is you get one person going house to house. So think about this. Some have said, well, what if I go house to house and do services? Think about a honeybee. A honeybee goes flower to flower. What do? They pollinate. They spread the pollen. So here the pollen is COVID-19. And so if you have one honeybee going house to house trying to put in-house services, you have now just pollinated that disease throughout a community. So when we say stay apart from each other, physically apart from each other, not socially isolated, but physically separated from each other, it's because we don't want honeybees and we don't want buckshot, because if you do those 2 things, it takes off like wildfire. So all the graphs the governor has been showing you are all really good science. And if you listen to the nation's top infectious disease doctor, Dr. Fauci, the CDC, a man who went to the same college I did, Holy Cross, by the way, and you listen to how he describes and explains this stuff, the way we have to contain this is to keep ourselves away from each other so the infection doesn't spread. So again, I couldn't be more proud of Team Kentucky. The volunteerism and the spirit of generosity and kindness and love that I see coming out is really inspiring and really, quite frankly, quite humbling. And I couldn't be more proud of the leadership that the governor has brought forth to this, because I think through that we have an opportunity to bring ourselves together and overcome this. So today there's no message from me about calling folks out. Just don't be the people who don't listen to this. This is not a drill. This is serious, and if we do it together, we're going to overcome it. But if individuals keep trying to find ways around the things we're doing, those individuals are going to hurt a lot of people. So let's, as communities, rally together, and as communities set the expectation for what we want from our neighbors and what being a good neighbor is in this admittedly historic time. So thank you very much, Governor, for the opportunity to serve the state, and thank all of you for what you're doing.
Thank you. We are very lucky to have Dr. Stack. He didn't tell me he'd talk about 8 years of Latin and give a Holy Cross shout out, though. We will review his notes the next time before it comes up here. In all seriousness, and you got to find those moments to laugh, to hug your kids during all of this. We really appreciate him. I could not be doing what I'm doing without him. Again, we talk about Team Kentucky. It's much bigger than me. Speaking of which, we are still asking for folks to, when they fill up social media, use our tags. Talks about us being together as a people. It's Team Kentucky, Together KY, and Patriot, because this is the challenge to our people here in America. And when you follow this guidance, it means you are not spreading it. You are a patriot. we want to add one here today, and that is healthy at home. What we know as we move forward is we have to cut our social interactions. We've got to make sure that while we are there with our family, that we create the distance we need with other families physically. That doesn't mean it has to be emotionally, and we have so many ways to talk to each other, that the healthiest place that we can be right now is in our homes when we are not going to the places that we need to make sure that we have enough. But let me say, when we go to those places, when you go to the grocery store, when you go to the gas station, you have to engage in social distancing. I know it's tough. You show up at a grocery store, you haven't been able to see people in so long. You really want to go up and talk within a couple feet or give a pat on the back to someone you know and care about. We can't be doing that. You can say hi from 6 feet away. You can have that brief conversation. 6 feet is a lot closer than people think. But we can't use those moments that we go out to a place where there may be a crowd to get the things that we need to ultimately undermine the guidelines that are there. So if you are going to a store and there's a line, spread out 6 feet apart. It's what, about 2 carts? Just make sure that there's that distance. And once you're inside, keep that distance too. And that can be tough. I know you want to get in. I know you want to make sure that you have everything that you need. But remember, in every act right now, every act we make, we are having to live up to guidelines to do everything we can to protect other people. Going to go through some of the steps that we have taken. I'm not going to go through our exhaustive list, but I realized when I didn't do it yesterday, which may have been a big relief to some, we didn't get to talk about, again, the places we go for information, the things that we need to be doing. So first, we've declared a state of emergency in Kentucky. We are still under it, and we're going to be under it until we have fully defeated this virus. We've activated our Emergency Management Operations Center. That's the group with which we are planning to get to that day where we can provide a test to everyone who wants it. We are working to make sure that we are ready as a state within less than 48 hours, because we keep working and working and working, that once we have the supplies, which everybody in America are trying to get, that we would be able to make that happen. Our goal is to make sure nobody has to wait because of the Commonwealth of Kentucky, that once we have those materials, that we'll be ready. And we're not there yet. And every time the federal government gives us a new date, it changes. But, I'm to the point where we're going to take care of Kentucky right here in Kentucky. So we're going to work every day to get those supplies, and the moment we can make it happen, we'll make it happen. Remember, until that point, while there are lots of new resources coming online, while there are lots of new labs coming online, and that's a good thing, make sure that the people who are ultimately going and being tested are the ones that need it the most. If you are well but nervous, right now is not the time to get one of these tests. I get it. I get that for our emotional health you'd want it, but as we know our cases are increasing, and as we know our resources are limited, we got to be really disciplined. We got to be that really good neighbor if we are doing all right. So we put up this when to seek care guide. And again, if you are, and this is a little bit older, if you are worried but well, at this time, we are asking that you don't even call our coronavirus hotline. With the increase in cases that we see, and we'll continue to see it. That's the way these things work. We're asking you to do everything you can to hold it together, and I know that's not easy. But make sure that line is open and available for those that are sick but might not have otherwise sought care, and those who are sick and would have sought care. And again, before going to a healthcare facility, make sure that you call your doctor, you call the Corona hotline unless you are sick and would have sought care, or you are injured and need to seek care, in which case, go and do it. One of the reasons we've been talking about this so much is that we know that we're going to have more cases, and I want to make sure that there's a doctor and a nurse and everybody that's there to be able to see those who our loved ones need to see when they need to see them. And that means that when we're well and we're not taking up that doctor, we're not taking up that nurse, we're not taking up that time, where those that are going to truly need them can get to them. Our coronavirus hotline is 1-800-722-5725. Let's go to the website. Our COVID-19, that's this novel coronavirus, website is kycovid19.ky.gov. We're adding materials to it every day. It has guidance for many situations. It has an update on the orders and steps we have taken. Know that our numbers are a little bit different on here because these are the numbers that are confirmed by our lab. And one of our challenges right now is, as everybody is ramping up to provide as many tests as they can, there's communication gaps. That's going to happen when we're asking everybody to do something faster than they've ever done it. So stick with us. I will give you the best information I can. I'll give you the best number that I believe is accurate as of today. But know that the website is going to be based on confirmed cases that are out there. And one of the things about having this many labs coming up is we also lose the ability to track the negatives out there, the total number of tests that have been done. We now believe it significantly exceeds 1,000. I'd be surprised if it's not over 1,500 or greater at this point. Those are numbers that we don't have, and we're working to get them. But there are, again, it's one of those things that happens because of a good thing we see out there. It just comes with some difficulty of information. There's a price gouging order in effect. If you see price gouging, dial 888-432-9257. We're going to extend it. We can't extend it until it's about to expire. We're obviously going to do that. Sick leave is really important right now. Business, and we're doing it in state government, you need to make sure that someone who is sick can stay home. For a group the other day that seemed to brag about having 6 weeks of unpaid leave, that doesn't help anybody. That's saying they won't lose their job, so they can't get unemployment, but they can't get paid if they're sick. Please don't be that organization that acts like you're doing something great when your people need so much more from you. The CDC guidelines are up there. They are so important. Avoid crowds bigger than 10, but avoid crowds here in Kentucky that we're doing at all. If you're over 60 or if you're a part of the vulnerable population, please take extra precautions. We have issued the executive orders to where we believe that both testing and treatment can and will be free to all Kentuckians. And that, again, is when we're going to have the resources to make sure that all Kentuckians can get that testing. We've made sure pharmacies can refill your prescriptions. Call your pharmacy. Don't go in to see your doctor right now if it's a routine prescription. We'll re-up this when the first 30 days run out. Schools have ceased their in-class activities. We've asked them to extend that to April 20th. We got to make sure that we have enough time to defeat this virus, and we will evaluate as we go whether or not we'll have to extend it past that. Our school systems have been amazing. They have responded. They're doing everything they can to still provide instruction to their students. Every single school district is now qualified to try to do that. And how they've come together in almost every district to deliver meals is nothing short than patriotic at a time when it is so needed. All community gatherings should be canceled or postponed. That is, all of them. I know that it is Saturday and we have Sunday coming up. I know for many houses of worship, that is the day that otherwise people would be together. All of that needs to be done remotely. That can be live streamed. It can be over a radio station. It can be over television. Any way that you can do it remotely. We now have very specific examples in multiple parts of the state about where this coronavirus has been spread in a house of worship. My faith is one of the things that keeps me going in the job that I do, and I absolutely know in my heart that God gives us wisdom and wouldn't want us to be in a small confined space where this coronavirus would spread. But I am going to ask for something. People that might not be able to see their service on social media, might not be able to hear it on the radio, I think it still helps us when we know that these organizations are out there. And so if you're willing, at 10 o'clock Eastern Time this Sunday morning, we'd love you to ring your bells. It's been done at other times in America, and it just reminds us that we're all here, that our Creator, regardless of your faith, cares about us, and we will make it through. And just because we can't go to a building together where we talk about it doesn't mean that it is not there with us and helping to guide us, and we'll make sure that we come out of this together. We've taken a number of other steps. As you know, restaurants and bars are now closed to in-person service. Any business that is a front-facing business, with some exceptions, are now closed. Child care centers, with the exception of for certain first responders and healthcare workers, aren't going to be open this next week. Senior centers and just about any area that caters to or protects our seniors are either closed for visitors or they are closed if seniors don't live there. That is incredibly important that we follow that. We've even pushed back our elections right now to June 23rd, 2020. But to any poll worker that's nervous about that time, I will not put you in harm's way, no matter what, as we come up to that date. We are continuing to work to make sure that our state government is modeling with fewer and fewer people that come in every day. And we have a lot of other steps that we have taken. Again, they are all up there on our website. Let me again remind people that started their unemployment applications this week. You need to finish them by 11:59 tonight. That will make sure that you don't have to go back. That'll make sure you don't have to fill out anything a second time. These are already frustrating enough times. We want to make sure you get those in. Next week, we need you to follow this schedule. Remember, if you qualify for unemployment, get it. And we are in unprecedented times. There is no stigma for public assistance. We want as many of you all to sign up as possible. For independent contractors, for small business owners, the SBA news is good. I hope to bring you more good news next week. We're doing everything on our side. We could be helped with either presidential action or an act of Congress to make it easier, but even without that, we're going to do everything we can to try to make unemployment available to our independent contractors. You are going through the same thing as everybody else. I know it doesn't seem fair. These systems were created during times that couldn't anticipate what we're going through. I will continue to work for you to try to make sure that we do the right thing, and we are there for you. More news coming out about our bourbon distillers producing a significant amount of hand sanitizer at a time when it can be hard to find. They are getting it out there, and we appreciate them. All right, with that, we're going to do about 10 or 15 minutes of questions. And again, we've got questions that come in from the public, from reporters that can't be here, and from reporters that can be here. And I'm going to try to be as fair as I can and going back and forth, taking a question from here and then a couple questions from those that have written them in. Would you like to start us?
The 18-month-old baby and the 6-year-old, I know they're both from, is there any connection with daycare or with anything like that we know of?
The question is for the 8-month-old. Yeah, and the 6-year-old. Do we believe there's any connection with daycare, or we don't have any information that suggests that? And it, it's tough when we look at our kids to know exactly how many are getting the coronavirus, because they are really resilient. They don't really show any signs, and even when they get sick, they rebound from it really fast. So what we know is that they can get it and spread it. And being the most asymptomatic group, meaning not showing when they have it, it's really important to limit their contacts too. And that's tough. That's really tough. It's one of the reasons that we don't have in-person school right now. because our kids are so connected and so physically connected in so many ways. And that's one of the challenges as we go through this. But I think what that means is the family around them or the caregivers around them, it's more important now than ever. Here's a question. The president has recommended reusing sanitized masks. Is this safe, or would it pose an additional risk to healthcare workers? We don't think that we ought to be reusing those masks, and we're going to do everything we can to find as much PPE, that's personal protective equipment, as we can. But I'll level with you. There is a massive shortage in the country, and we are doing everything we can each and every day to find it. But what that means is those healthcare workers that come in, and they should know this, we should be honest with them, are doing heroic work. I mean, they are walking in to the danger that we need them to, even though they know that on a daily basis they may be exposed to this. They are special. And so if you are in a waiting room, if you are it's taking time to get in, and you are frustrated and you may be angry, know that that person who is helping you knows that they might be exposed, but they are doing it anyways. And please try to treat them that way too. We have a question asking for a response from a public health official. I guess they're saying not me. On the likelihood that coronavirus will be adequately contained in time for the Kentucky Derby to rerun in September. Folks, I'm answering this because I'm not going to tell people what we don't know. We don't know exactly how this virus is going to respond as we move forward. We know that if we limit our contacts, we can limit the spread. But what's important is that we are committed to doing everything it takes to defeat it the first time. Listen, I more than anybody want to be at the Kentucky Derby in September. They let me hand out the trophy. But we're going to do what it takes to make sure that people are safe. And the tough part about this time is that there isn't certainty. But at every challenge that we've faced, every major one in our country, whether it is a war we have been in, whether it is the Spanish flu in the past, whatever that challenge is, there's never been certainty on the other side about where it comes out. It has only been us against that challenge, knowing that if we come together, we can defeat it, and we are strong enough and persistent and resilient enough. And I want to make sure that we're doing that we're not just telling people, oh, if we can just make it for the next 2 weeks or the next month. No, we got to be committed. We're going to do this. We're going to come out on the other side. We're going to make it.
You mentioned the flea market not closing initially. Are there updated guidelines for where people can go to report businesses that aren't complying?
We are working on that. That was the question is there a number that people can go to report groups, gatherings? I don't want to just single out business that aren't complying with the guidelines. I'm hoping to have an announcement on that on Monday. That was a very good idea that was proposed yesterday. We want people to feel safe where they are. And this is a question that is like that. Guidance on other automotive manufacturing industry employers who are still working that produce parts and where they might not have people spread out. Any industry, any business out there, understand if you don't spread your people out, that if you don't follow these CDC guidelines, and that you aren't absolutely essential to what people need on a daily basis, if you can't make it work, then we will have to take action. And I want those that are concerned to understand we hear them and that we are working on it each and every day. Phil.
Governor, I know that Senate Majority Leader Mitch McConnell has several times said he's spoken with you on the Senate floor. I'd like to know, have you had a chance to speak with anyone from the White House, including the President? And how would you judge President Trump's handling of the crisis?
The question was whether I've had an opportunity to talk to people in the White House, the President and the Vice President, and how I would judge their response. I will say I've been on a call with the President and the Vice President a little more than once a week. There's a long queue to ask questions. I've tried to get in there. I ultimately didn't have the opportunity, but that doesn't mean that they weren't providing information on it. Second part of that question is admittedly something I'm just pretty done with right now, and that's the political side that goes back and forth on cable news. I'm here to protect Kentucky. I'm just not interested in the Democratic or Republican back and forth on the judging people for this or for that. What I want is I want the federal government, and I don't care which party that they are in right now, to just work hard every day to provide what we need here, to look out for our people, to make sure that independent contractors can qualify for unemployment insurance, to just know that we are in a different time, and what we have to do is everything for our people. Our family resource centers, our Friskies, I know, have always had a motto, and it's whatever it takes to get the job done. That's where we are in Kentucky, and that's where we got to be in this country. Okay, today we are airing a story about a Kentucky family we spoke with that is currently stranded in Honduras. They traveled there before all the lockdowns took place for a family trip, and now they have no way to get home. Can we tell how many Kentucky residents are currently out of the country, and what kind of help is being provided to them so they can return back home safely? I do not have a number on that. And to those families that are out there and want to get home, we hear you. We worked and we worked and we worked to get those passengers from the Grand Princess home. It was a Herculean effort, and they were here in the United States. To all of them, I know some of the stories about what they went through. It shouldn't have happened, but we are glad that you are home. We will get on top of any requests that we can make to get our people back here in Kentucky. And let me just take a moment to talk about the compassion that we have to show. When someone tests positive for the coronavirus, they are not a leper. This thing is out there. It's going to be impacting people that we know. We have to be there. We have to be kind. We have to understand that if they were at something that we were at, they didn't know. They didn't know. And it's not their fault. And that most likely, while you may hear about one person that you may be in contact with the way this spreads, you've been in contact with multiple other people too. So instead of our reaction being a how could you or an anger, how about you just worry about how they're doing? How about you check with them and their family? Especially in our small communities where people can figure out, who folks we report are. Let's be there for them. Nobody is in a tougher situation at the moment than they are, and let's make sure that we provide the support to our fellow human being that we need to. Here's a question about steps being taken to reach out to the Amish and the Mennonite communities in Kentucky. We would take any suggestions, especially by the local health departments and the others that traditionally work with these communities. This question is a really good point. It's that we need to work every day to make sure that we can get this message not just to those that report on it here or those that get to watch, but we need to make sure we're getting it to everybody. And let me just add, there's time for all of us to be leaders. This isn't what we do when asked. If you interact with those communities, and again, you can do it safely with social distancing, think about ways that you can provide the information we give here to those communities. It's just like the amazing work we see out of our school systems, our houses of faith, and others that have come together to provide meals for those that need them. That wasn't something that was directly asked. That was something they stepped up to do. Yes?
You tweeted about sheltering in place. How close is Kentucky getting to that, if we are?
We continue. The question is sheltering in place and how close we are to getting there. The term shelter in place, I think, is a term that evokes emotions in people that don't line up to what other states have done, and I just want to start there. Shelter in place is a term that's commonly been used in two scenarios. One is, say you have a rail car accident and you have a chemical spill or leak, and the other is when there's been active shooters in a particular area. And those are orders where you are supposed to get in your home and lock the doors and board the windows until people say that it's okay. What we will be talking about, and what we'll probably have to take some steps moving forward on, is just limiting our direct interactions with people. So even in the states that have put out the strictest orders that are there, and those are states that have significant, and we have significant, but have very significant positive cases, allow people to go to the grocery store, go for a walk as long as you're engaging in social distancing, to do all the things that are necessary to make sure that we get through it. You know, the way we're talking about steps we've taken real significant steps. Some of these states that are now using this term are including things they haven't done for the first time, like closing bars and restaurants, or forward-facing businesses, or daycares, or limiting visitation to senior centers. I mean, we've been aggressive in Kentucky, but what we've done is talk about it in, I think, a more responsible way about what it really means to your daily life. And hopefully we've talked about it in a way that is more empathetic, that is understanding that we got to use terms and language in terms of compassion and kindness and our emotional health that truly describe what we're doing. And so we are encouraging our healthy at home. And right now, yes, there are guidance and restrictions out there, but the more that you follow the healthy at home, the better you are doing and the better we are doing. Go through a couple others and then I'll take another. There's a question about LIHEAP. LIHEAP funding ends March 31st. While they've been gracious in not cutting off utility bills, they're still accruing. So can we extend the LIHEAP crisis? Can we extend the date for LIHEAP? And in social distancing, to loosen the requirements of an actual signature on the application. First, we're going to work with our utilities, but I'm going to make sure nobody's cut off. And whether that is increasing LIHEAP funding or the rest, now is not the time to cut off people's power or their water or evict them from their home. I mean, we are in a different place than we've ever been, and we can't kick people out on the street or make it harder to stay in their homes when we're asking them to be healthy at home. And again, to everybody out there, we've all made changes as individuals, and I know for some, that means you're applying for unemployment when you never thought you'd had to. And so I hope others can understand that there is no more bottom line, and there shouldn't be until we are through this. If you are the lucky business that's still operating right now, when bars and restaurants and forward-facing businesses have had to at least curtail how they're doing them, now should not be a time of major profit. Now should be a time of patriotism where you realize how necessary you are and you adjust your prices to help out folks that need it, and or you use that extra money to ramp up your workforce to make sure people are there. Now is a time of national patriotism and for us to be the best Kentuckians that we can be and realize we'll get through this, we'll rebuild, we'll restock, we'll do everything it takes. But now is not the time for profit. Now is the time for people. Let's take one more here and then I'll do one more there.
Governor, I know you said moments ago that you are committed to protecting poll workers. I've talked to a number of folks who have volunteered that who say they can't imagine, voting is a very communal activity. They can't imagine how we could pull this off even on June 23rd. Number one, do you support a mail-in system? Would you be open to that, supporting that idea of people mailing in their vote? And as we are talking about maybe July and September, it's not the state's purview, but does Congress need to start thinking about the federal election in November?
So the question is about elections and about some poll workers that Phil has talked to about how communal of an act it is and the way that it's being done right now. And do I support mail-in voting? And does Congress need to act on the federal election? Well, what we've certainly done by moving the elections back is buy us time to see where this virus is going, to see what the increase of cases is going to look like, but also what the decrease of cases is going to look like. So I believe that all options should be on the table. I know our Secretary of State is looking at and willing to consider mail-in ballots. I think that's good. I think it's a good sign that our Secretary of State is also putting aside philosophy and figuring out how we could carry this out at a time when it's possible at that point that it's not safe for poll workers to be there. What I do want to be very positive about is whether I have to go to Congress, whether I've got to use emergency powers in this state, whether we have to look at options like vote-in mailing. I'm not going to put poll workers in a dangerous place, and I'm not going to create crowds and lines if it is not safe to do so. Last, should employees of salons and other business ordered to shut down be allowed to make private house calls to provide services? I think Dr. Stack answered this. To those who are doing this, first, let me say that I'm sorry. I'm sorry we've had to shut down your business, your dream, something that you have probably worked very hard in your life to be able to do. But it is absolutely necessary to protect the health and even the lives of the most vulnerable among us. That while I understand that it wouldn't be people coming in to a facility, it's that honeybee example that Dr. Stack just gave us, where we would increase the contacts and your contact would then be added to theirs, and then to the next client, and then to the next client, and all of those come together. We are doing everything we can with the SBA. I'm working every day on the unemployment insurance side. I know it's tough, and I know with other restrictions out there, or lack of them, it may seem unfair. To you, all I can say is we're doing the best we can, and that we're making the best decisions we can to protect people. And looking back, I know that they won't be perfect. Now, this thing's only existed for about 3 months. None of us have ever dealt with it. Looking back, on my most optimistic day, I hope people say that I was too aggressive, because if that means that we truly impact the number of cases that we see and protect more Kentuckians, that's something that I would be very happy to live with. Your loved ones out there are so important. They're my people that I'm sworn to protect in this job, and I'm going to do everything I can to do it. So let me just close. The way we do each time is this is our test, but it's also our time. We think back on the greatest generation, and we think back on generations before that were called to face an adversary in times of uncertainty without knowing exactly how long it would take and without having everything they needed to do it. Those generations have answered the call every time, and I believe ours can too. It's going to take us being physically and emotionally strong. It's going to take us being resilient. It's going to take us knowing that there's going to be a time where we think we should loosen restrictions, where we got to stick with it because we got to win on the first time. And it's going to take us being really good people. This is different in other things we faced, because while we have faced things that create anxiety, the solution to almost every other time has been to come together and not to stay apart. But again, just because it's difficult doesn't mean we're not ready for it. Doesn't mean we're not up to it. Doesn't mean that we coming together, everybody doing their duty, can't get it done. And so if you're at the store and you're in the aisles and you're frustrated, breathe. If you're at home and you're stir crazy because your 9 and 10-year-old are bouncing off the walls, breathe. If you were worried about your parents or your grandparents because you can't see them, I know it's hard, but breathe. We're going to make it. We're going to do it. And we're going to protect our people as we go. Thank y'all.
Thank you, Governor.
Thank you.